Good day. On behalf of the Tissue Viability Society and the sponsors of this webinar, Molnlycke, I'd like to welcome you here today. So welcome to the second in our series of Stop the Pressure Ulcers Skin webinars. This and the other series will be available on the TVS website shortly after presentation. So if you want a copy of the slides, you can't have them, but you can go and watch the video presentation anytime. Now, our series is based on skin, S-K-I-N. The first being focused on S for skin assessment in those with the darker skin tones, which was yesterday, and tomorrow I will be for increased moisture. Today, the focus is on K for keep moving. Now, we are all aware that to prevent pressure ulcers, we must keep the patient moving and offloading pressure. But what happens when we can't move the patient to offload the pressure? For example, in those that need to be positioned in the prone position to treat their condition. Now, due to COVID-19 pandemic, an increased number of patients has been and are continuing to be admitted to intensive care that need to be nursed in the prone position for extended periods in order to aid their mechanical ventilation. Now, these patients have to remain in this position for a long period of time and require a large number of people to reposition them. Therefore, they're not moved very frequently. So hopefully this presentation will help us to see what we can do to help prevent pressure ulcers in those circumstances and see how clinicians manage that increased risk for developing pressure ulcers. So I'd like to introduce you to John, and John will be answering our questions later today. So John, welcome.
Hi there, Tina. How are you?
I'm fine, thank you. You?
Good, thanks. Yeah, I'm here in Sweden at the Molnlycke office today, so traveling for a change. I'll take over from here, Tina. I'm going to introduce you now to our speaker, our presenter this afternoon, who's Dr. Michelle Barakat-Johnson. She's the Skin Integrity Lead at the University of Sydney. And she also works at Queensland University of Technology as well. And I had the pleasure of meeting Michelle in Sydney just before COVID. And Michelle's going to present you today a presentation which looks at the prevention of pressure injuries while proning patients. And as Tina said, this has been a massive issue during COVID. So I'll hand over to Tina now, and she's going to start the video.
Hello, my name is Michelle Barakat-Johnson. I work as the Skin Integrity Lead at a local health district in Sydney, Australia. Our local health district has 4 hospitals and 5 community health centres. And I would like to thank Molnlycke for inviting me to present this webinar series about a subject that we've all faced, that's COVID-19. I particularly have a special interest in COVID-19 because we admitted a number of patients who had COVID-19 and were prone. This is the second webinar in a series of 3 webinars. In the first webinar, we looked at the risk of pressure injuries in prone patients and what we have learnt during the COVID-19 pandemic. In this webinar, we'll highlight best practice in pressure injury prevention and how prophylactic dressings can help in prone position patients. And the third webinar will focus on clinical practice change and how we actually adopt best practice with reference to pressure injury prevention in prone position patients. So just to recap, on webinar 1 and what we covered, we talked about that ever increasing in numbers of patients presenting with acute respiratory distress syndrome, and it's been recommended by critical care practice guidelines and governing bodies to prone patients. We treated prone patients in a COVID ARDS prone position because it improves ventilation and oxygenation. We looked at being in a prone position for extended periods and how that's actually associated with pressure injuries. It's really important that prior to proning a patient, we take into consideration our support surfaces for the patient and other type of pressure injury prevention techniques. Because the patient's in a prone position for a number of hours and it's really hard to reposition them, prophylactic dressings are an important consideration. So today we'll cover prophylactic dressings and how they're a widely accepted intervention in reducing the occurrence of pressure injuries in patients who are at high risk of developing a pressure injury, especially those in a prone position. We also want to highlight that not all dressings are specifically designed to prevent pressure injuries. I also want to emphasise the importance of using dressings that are supported by robust scientific clinical evidence. And I want to run through what we developed in our district and the benefits of having dressing packs. So prophylactic dressings, well, they've become a widely accepted adjunct method of preventing the development of pressure injuries in patients considered to be at high risk of developing a pressure injury. The types of prophylactic dressings available include soft silicone foam, multi-layer dressings to redistribute the pressure and shear, such as Molnlycke border that you see there on the slide. There's also a Leave and Life and polyurethane dressings such as Opsite, Flexi Fit, hydrocolloid dressings such as Duragerm, extra thin to alleviate shear and friction. Prophylactic dressings are usually applied over bony prominences and where appropriate under medical devices. However, selection of the type of prophylactic dressing should take into consideration a number of factors, and these include dressings that have been proven to reduce pressure injury occurrence in rigorous studies. The anatomical location and the shape of dressing, the layers of the dressing, and if placed under medical device, should all be taken into consideration. And it's really important that the dressing we place under the medical device does not interfere with the actual device itself. And another thing here is that the dressing can actually absorb moisture, so it's got that moisture management and microclimate management. So how do prophylactic dressings work, and why do we choose prophylactic dressings? Well, with public health emergencies such as the COVID-19 pandemic, it really creates that urgent need to prevent negative outcomes such as pressure injuries. And we know that pressure injuries are a quality indicator for care of patients. So when we're looking at preventing negative outcomes, in doing so, we really want to use resources and materials that are currently available and techniques we already know work, especially when we're in a mid. Therefore, the use of these dressings in a prone position is an important consideration. However, to date, there remains little published data available with clinical evidence for the prevention of pressure injuries in prone position. But perhaps the most studied dressing with the strongest evidence in the prevention of pressure injuries in critically ill patients is the Molnlycke multi-layer soft silicone dressing. Molnlycke has laboratory computer modelling, which has shown that these dressings reduce friction, shear and pressure. And the most recent computer modelling of Molnlycke Border Flex has demonstrated a reduction in high-risk stresses by up to 70 to 80% in soft tissues over the iliac crest when exposed to multi-directional forces due to the flex component of the dressing that allows movement in all directions. A recent study published by one of our colleagues demonstrated that Molnlycke Border Flex alleviated soft tissue loads at the sites when the head is in a prone position. So we looked at what it showed is that the dressings actually relieved it more than 50% when you compare the pressure that's placed on the head in a prone position without any dressings. When we look at the use of dressings in the prevention of pressure injuries in a prone position, much of the research has predominantly focused on patients in a supine position, with evidence detailed to a number of studies that did not investigate the use of dressings in a prone position. However, there are 2 studies that suggest that soft silicone foam multi-layered prophylactic dressings, such as the Mepilex border, demonstrated adjunctive efficacy in the prevention of pressure injuries on areas such as the chest and also the iliac crest. A well-known trial known as the BOSS trial, when Mepilex border was compared to Opsite Flexifix in a prone lying patients in theatre, there was a marked difference between the Mepilex border group and the Opsite Flexifix, with significantly less pressure injuries in the Mepilex border group. So in terms of our evidence, well, as I mentioned before, there's a lot of evidence, a lot of strong evidence that really focuses on pressure injury prevention when a patient's in a supine position. And Nick Santamaria has conducted a number of randomised controlled trials in the intensive care setting that have really demonstrated effectiveness in pressure injury reduction. The recent Border Trial 3 had potential advantages testing the effectiveness of dressings on residential aged care individuals who were mostly incontinent of urine and faeces. And the reason why I mention it here, and when we're looking at prone patients, is because the dressing has the ability to wick moisture, and that's really integral to allow perspiration to evaporate and not remain on the skin. And I know a number of our patients that came into the ICU, they were quite cellulitic, and having them in a prone position, there's a lot of moisture due to perspiration. So it's a really important consideration in prone patients. Other types of silicone dressings have not as yet had a number of rigorous studies to show their effectiveness in the prevention of pressure injuries, particularly in critically ill patients. A recent pragmatic trial of 393 elderly patients with hip fractures demonstrated that Aleve in Life resulted in a reduction of sacral pressure injuries. In addition, there's been a quality improvement publication where they've used Aleve in Life to reduce the onset of pressure injuries. For example, Salmon and his colleagues identified that the use of Aleve in Life as part of the pressure injury program helped reduce the onset of sacral pressure injuries by 40%. So for our patients, we developed a protocol application for prophylactic dressings to be used on all patients who were proned. We used the Mepilex Border Flex for our COVID-19 critically ill patients. For ease of clinical use and clinical practice, we actually put together these dedicated packs of dressings, and one of our clinical nurse educators are holding those packs up. And we made these packs for each prone positioning event. The packs included quick instructions in dot points on how and where to apply the dressings, and a picture showing anatomical placement of the dressings. We started out by drawing a silhouette of the body, and we marked areas of high pressure in a prone position, and we were actually guided by the National Pressure Injury Panel guideline that was actually released in April sometime after COVID hit. And in that guideline, they had a number of suggestions around pressure injury prevention for patients in a prone position. We were also mindful that a number of our patients had medical devices, so when you put them in a prone position, that medical device can either be dislodged or it could also cause pressure. So we were mindful of that. We worked out what size and shape of the dressing by testing it on ourselves. So we actually peeled the dressings off. We put some on our forehead and on our chin, and we lied down on one of the beds in ICU. that were free. And we amended the sizes of the Mepilex border based on the size of the area and its ability to mould and cover the area, and of course for comfort. So we really kind of tested this a couple of times. We also discussed this with the product manager, who was very helpful. We discussed this at length with the intensivist, because we also wanted to make sure that the dressings didn't actually impact on any of the other treatment for patients in a prone position. The intensivist was very supportive and felt that the packs were very, very helpful, very convenient. And after a number of iterations and consults with nurse educators in the intensive care and the intensivists, we then finalised the diagram with the help of our strategic relations and communications. And you can see the diagram up there. That is a diagram that's included in the packs. They went off to print. We ordered the stock that we needed, and when we received the pack, for each proning pack, when we received the print, we actually put them in each proning pack. These packs were initially packed by myself and the Skin Integrity Wound Care consultant, but as the numbers grew higher, we actually moved into getting some admin support, which was very helpful. We used large size sandwich plastic bags, and we labelled each dressing with the location of the body. We labelled the dedicated packs of dressings, and we called them Prone Pressure Injury Relief Pack. Because they were packed compactly, they were then able to be stored in the ICU room, rather than having these boxes of different types of dressing shapes and sizes and expecting the clinician to go into the storeroom and selecting the ones they need. And we don't actually have time for that. So having these prone pressure relief packs were really, really convenient. We received a lot of positive feedback. So when a patient required them, they were easily accessible to all staff and clearly labelled. When the staff were low in stock, they would then call the Skin Integrity Nurse Consultant, and we made more up. We still have a number of packs left over. The packs were well communicated with the intensive care team via emails. All the staff were educated, and they were educated by the nurse educator when a patient was turned into a prone position. It was really hard to conduct education sessions amid a pandemic. So we found the opportunity when a patient was turned into a prone position, because usually we would need about 6 clinicians to actually help with that prone manoeuvre. This is one of our patients, and with his consent, he's allowed us to use these photos of him. He had COVID-19 acute respiratory distress syndrome, and was obviously cared for in a prone position. And with a team of 5 nurses and 1 doctor, we took a collaborative approach in identifying any pressure injuries on him before we conducted that prone manoeuvre. When we looked at the areas of the body, we really focused on the knees, the elbows, the hips, the clavicle, the sternum, the chin and the forehead. And we applied the Mepilex border to all of these areas. We monitored the skin, of course, and it's really hard when you've got someone in a prone position to peel back the dressings every 2 or 3 hours. That just wasn't going to happen. But what we did is we peeled back the dressings daily, and we performed those micro shifts, micro movements, hourly, lifting the knees and the feet and the shoulders if possible. And this actually proved to be quite successful, because none of our patients acquired pressure injuries in a 12-hour period whilst in a prone position. We did have patients who developed pressure injuries from medical devices, and again, we're still working towards the best possible solution for pressure injury prevention in that area. That was only 2 pressure injuries that were observed in the 3-month period around the medical devices. It became quite evident that the integration of the Proning Pack initiative assisted in ensuring the patient's skin was protected, and we do believe that further studies are critically needed in this area to determine the effectiveness of prophylactic dressings in patients who are in a prone position, and looking at dressing types, their application in preventing pressure injuries when patients are in a prone position. I'd just like to acknowledge a number of colleagues who we collaborated with when we developed these proning packs, and we've published on our proning packs and the effectiveness of those and how we went about putting the proning packs to get together. So in terms of some key important points to take home, it's really important to take on board that we know that not all dressings are specifically designed to help pressure injury prevention, and it's really important that there's robust scientific evidence behind that, that they work in pressure injury prevention. And also when we're looking at the critically ill and the intensive care setting, that's a different setting to a number of other settings. So also really important to be mindful of the patients in that setting and ensure that it doesn't clash with any other treatment strategies. For ease of application, and certainly for our district, we found it very, very useful to have these dedicated packs of dressings that were made up before the proning event and that were easy accessible, that were well labelled and just convenient for clinicians to be able to get hold of and apply on a patient. Thank you.
Hello, everybody, back again. Thank you very much to Michelle for that excellent presentation. Now I can see that there are a few comments and a few questions that we've got to ask about that. My first question for you, though, John, is about the body map there. Is that available for anybody to be able to download any resources?
Yeah, we've got quite a lot of resources on our website, actually. You can just go into the Molnlycke website itself, or you can go into the Molnlycke Advantage, which is our professional education website. There's actually a module on proning, so it's a learning module. It's called Connect to Know. If you click on that, then you can go in and actually do a module on how to prone and how to use prophylactic dressings. But we also have a prophylactic dressing guide for general sort of prevention of pressure injury, but also specifically one now for proning as well. And you can download that pack, and it's very similar to what Michelle was doing, because we kind of based a lot of what we did on the work that Michelle did in Australia. So that's all available, as I say, on the Molnlycke website, but also you can go through to get some of the resources from the Molnlycke Advantage site, which is also the professional education page. So there's plenty of links there. Oh, thank you. Someone's put that up in the chat.
Oh, fantastic. And I thought I saw some questions pop up, but they seem to have disappeared somewhere.
Yeah, sorry, I actually answered a couple of questions that were online. So Jackie Fletcher had asked the question about covering the nipple area, because that's definitely an area where there's a lot of extra friction, and she found that a specific issue when they were using proning. And so we kind of recommend that on our guide. It wasn't quite clear on Michelle's, but on our guide that we've produced, the nipple area is something that we do recommend covering, because it's a specific area where, you know, if patients are also warm as well in ITU, they can get a lot of moisture and friction damage and things like that. So we recommend covering the nipple area. And the other question she asked, I couldn't really answer, because it was around how successful or how well received were the packs and the bundles that Michelle did. The only thing I can say is that I'm aware that her teams were really, really pleased that these bundles were pre-made and everything was well labelled. And again, it gave us some ideas for how we, you know, talk about proning on our website and things, because I think that bundling everything up and stating where each dressing goes and the map and the diagram and everything was hugely successful. She said herself during the presentation that they started off making them up themselves, but then they get so much demand for the packs that they had to end up getting other people to make up the packs, like a big team, because there was so much demand for them. So I can only guess that it's been really a successful venture, and it really must have prevented a lot of pressure injuries for her patient group. So it was a really, I agree with you, it was a really interesting presentation, and actually quite simple, you know. So yeah, I see there's a couple of more questions, I think, Tina, on in the Q&A.
All right, those are the questions that I found in the Q&A.
Okay.
To be honest, I can't find any questions on the chat. I mean, I have to say that I do agree with you that the idea of having a simple pack that goes to the patient's bedside, I can only imagine that saved a huge amount of time and effort, knowing how many boxes that you can go through and find just the information leaflet because somebody hasn't thrown the box away. And things. So I can imagine that that's a really good thing there. Now, just to remind everybody that they can watch the video again on catch up if they want to catch up with any of those. So that's going to be available to everybody. Certificates are going to be available for you to download from the website. Now, if anybody has any more questions, could I ask you to type those in quickly because
sorry to interrupt, Tina. There's a question from Jeannie Donnelly and then a further question from Jackie that I don't think we've addressed in the Q&A.
All right. Oh, they're not on my list.
Yeah,
can you see it?
I can see the questions in the Q&A. So Jeannie Donnelly's asking about the issue of moisture damage underneath the dressings, and of course Michelle did raise that in terms of the dressing that she used were pretty good in terms of managing that microclimate, if you like. You know, they do have good moisture vapor transmission rates, but like all of these situations that, you know, it's very warm in ITU and moisture damage could be a problem, I would imagine, over time. But she didn't mention that specifically. But what I would say, Jeannie, is that rather than me kind of make up an answer, you know, on Michelle's behalf, I think what we'll do is we'll relay that question to Michelle and then get you an answer direct from Michelle herself, because I think that only she could really answer that one. But I do appreciate that, you know, with the patients proning in ITU, excuse the background noise, sorry, then I think it's definitely an issue, and it could be even under a good quality dressing that could happen. So yeah.
Thank you very much. Now, if anyone can see any other questions there, because I don't think that I can see any questions.
Sorry, Tina, we've got one more from Jackie, and she said, did you find the sizes worked for all patients?
I can only answer this again very much that we recommend in our guides that you need to adapt the size for the size of the patients. Now, some bariatric patients and things, you do need to use larger sizes. But again, to answer on Michelle's behalf, I think we'd have to go back to her specifically just to find out exactly. You know, I think that would probably work for the majority of patients, but again, we recommend sort of for larger patients to be using larger dressing sizes, and that would obviously answer that question partly. But I think I'll get Michelle to answer that specifically, Jackie.
Well, thank you very much, everybody. Thank you very much, John, for answering the questions on behalf of Michelle. I'd like to thank everybody for being here today. And if you're here not today, but you're catching up on catch up, you know, welcome and thank you for attending this. Thank you very much to Molnlycke for sponsoring this webinar. And I do hope that people will sign on and come to our webinar, which is at the same time tomorrow. Thank you very much for your attendance. Goodbye.
Thank you.
Bye. Bye, John.
Bye-bye.
Thank you.
Bye-bye. Thank you.